In this video, we'll discuss all of the activities you'll learn in week 1 of the human skeletal system. We'll be focusing on the bones of the axial skeleton. To define this, the axial skeleton forms the central supporting axis of the body. It includes the skull, auditory ossicles, the hyoid bone, vertebral column, ribs, and the sternum. In this image, you can see the teal color identifying those regions of the axial skeleton. In week 2, you'll learn the bones and the joints of the appendicular skeleton. This includes the pectoral girdle, the bones of the upper limbs, the pelvic girdle, and the lower limbs, illustrated here using the cream or the bone-colored tissue. During lab, you'll first identify bones and bone markings. This is in preparation for quiz and practical questions which we'll read, identify this bone marking, and the name of the bone. It's important that you be able to distinguish right and left for any duplicate structures in lab. You'll also be classifying the joints of the axial skeleton. For each joint listed in the lab manual, you should know the joint name, the articulation components, and the structural classification as written. Keep in mind you must be able to spell correctly using the 2-letter rule, and that you should use your textbook and your lab manual to help you find the structures that you are responsible for. To begin with, let's discuss joints. You'll see in the lab manual where it's defined as the functional classification of joints, and this describes the amount of movement a joint is capable of. Immovable joints are classified as synarthroses. If they are considered amphiarthroses, that means they're slightly movable. And if they're classified functionally as diarthroses, that means they are freely movable. You should be familiar with the concept that anatomy determines physiology. So in this case, we'll see that the structure of a joint determines the function of each joint. In lab, you'll spend much more time on this functional classification of joints so that the functional classification makes more sense in lecture. So again, a joint structural classification describes the tissues associated with a specific articulation. It's important that you identify structural classifications by listing first the major classification and then the sub-classification, as you can see written below. For all fibrous joints, it's important that you identify them structurally as fibrous sutures, fibrous gomphosis, or a fibrous syndesmosis. For cartilaginous joints, classify them as a cartilaginous synchondrosis or a cartilaginous symphysis. For synovial joints, classify them as a synovial plane, synovial hinge, synovial pivot, synovial condylar, synovial saddle, or a synovial ball and socket joint. To just show you briefly what each joint looks like, we start with the fibrous joints. Fibrous joints are structurally classified because they're formed through bands of short collagen fibers. This is the reason that there's such reduced mobility. Fibrous sutures are going to occur within the skull, as you'll see in lab, and they're so short that you really can't even see the fibers there. A fibrous gomphosis is best illustrated by the periodontal ligament, anchoring teeth into the jaw, and a fibrous syndesmosis like this has the longer bundles of collagen fibers, well illustrated here by the distal tibiofibular ligament. Cartilaginous joints are so named because the bones are articulated through a piece of cartilage. Cartilaginous synchondrosis is the classification given to joints which use hyaline cartilage. Cartilaginous symphysis is the classification given when fibrocartilage is what's joining the two articulating bones. Here you can see an example of a cartilaginous synchondrosis within costal cartilage, anchoring your ribs to the sternum. You can see cartilaginous symphysis joints in the terms of the pubic symphysis, as well as intervertebral discs. Synovial joints are the most complex in the body. What you'll see here for each structure is that you'll have two articulating bones, each covered with a layer of an articular cartilage. This is made of hyaline cartilage connective tissue. And between those, you'll see space known as the joint cavity. This joint cavity is filled with synovial fluid to increase mobility of the two bones as they rub against one another. It's then surrounded externally by a fibrous capsule, as well as surrounding extracapsular ligaments in many places. These joints themselves are classified as diarthrotic, and so you'll see through the table that all synovial joints are freely movable. As you classify them, it's important to know that they have 6 separate subclassifications. We highlighted those a second ago and how you can identify them. Here's a good visual representation of where they get their names from. The ball and socket, like what you'd see with the shoulder and the hip, looks just like this, a ball sitting inside of what looks like a golf tee or a shallow bowl. Synovial pivot joints right here will have one component here that's concave that rotates around a radius of some kind, which is one reason the radius gets its name. The synovial saddle looks like two saddles, one upright and one inverted that rub together. A synovial hinge works like the hinge of a door or a cabinet. Synovial plane tends to be two flat structures which rub together in a gliding motion. And a synovial condyle almost looks like a shallow ball and socket. So there's less movement here than what you would see in the ball and socket, but that same concave and convex shape. As you read the joint tables in the lab manual, they'll look like this. They'll list the joint name, the articulation components, the structural classification, functional classification, and description of movement. In lab, you're responsible for the first three columns that I've highlighted here with blue arrows. In lecture, you'll discuss the functional classification and the description of movement. It's important to emphasize one more time that if you identify structural classification, you must list the major classification and the subclassification as written. So I like to say it's a two-word answer, fibrous joint, for example, or synovial plane joint. Keep in mind that you are working with human bones. These are not fake representations, and so it's important that you treat the bones with respect. Do not use pens or pencils to point at structures because you tend to mark on the bones, and that's difficult to remove. Instead, we'll supply you with either cotton tips or we'll give you pipe cleaners to point with. Please return bones to the boxes when you're finished. If you leave them on the counter, there's a greater likelihood that they'll get knocked off and broken. Keep in mind that any students will be removed from the lab if they're not managing materials correctly. So use them respectfully and with care, and you'll be able to continue to study with them. I think it's a good thing to start off by learning some of your bone terminology for the bone markings. It's going to reduce some of the confusion that you run into. A lot of these words are new to many students, and so if you take a few minutes and you study the terms here in Table 8.2 from your textbook, it can help clarify what you're learning. You will not be tested on these terms, but knowing them will make this lab period much simpler. The tips for study for the axial skeleton are as follows. Be sure to use your textbook and anatomy.tv to find the structures first. When you're struggling in lab to identify where a specific component is, try looking at these images first. We are there to help you understand how some of these structures might differ from one another or to clarify things that you haven't been able to find. It's also important to practice before lab. There's a few ways to do this. You can use some of the images through anatomy.tv to quiz yourself. You can build some kind of a quiz on flashcards or equivalent. We think it's helpful to print off unlabeled images of the bones, put them in page protectors, and then use dry erase markers to write and erase. You'll see in your file folders in TCU Online that we have an unlabeled PowerPoint presentation ready for you to print and use. Read the descriptions in the lab manual. There's many places where we describe the locations or the borders of bones and bone markings. While in lab, be sure to observe at least 3 of each type of bone. There's a lot of differences between the different bones that you see, and so it's important to see that variety in the lab while you're there. Another thing you should note here in terms of classification, when you're examining the sutures of the skull, keep in mind that these sutures exist between bones and do not need to be identified as part of a bone. You'd never be expected to say the squamous suture of the temporal bone. Rather, on a quiz or a practical, the question would just simply read, identify this suture. The next, find general characteristics of each of the vertebrae that you're looking at, in addition to the group characteristics. You'll see a list of these general characteristics in the lab manual, and these are characteristics that pertain to cervical, thoracic, and lumbar vertebrae in general. So be sure to find all of those first. Then below that in the lab manual, you'll see all of the individual characteristics for each group that set them apart. So when you see the characteristics for cervical vertebrae that include things like a bifid spinous process, transverse foramina, keep in mind that those are only found on cervical vertebra and that they exist in addition to the general characteristics listed above. The next is that rib classification will only be necessary on an articulated skeleton. You will not be asked to see a disarticulated rib and classify it as a true, false, or floating rib. However, you are responsible for knowing the individual bone markings on disarticulated ribs, so be sure to cover that. In lab, you'll see two articulated skeletons that are there to help you. I recommend that you use them to help study joint anatomy so that you're aware of where joints exist and what they look like. That gives you a better idea of how to classify them structurally. It's important to use those to help you find a frontal sinus, as those are not apparent on most of the human skulls that we have. Use them also to identify nasal concha, since many of these nasal conchae have been broken in the real skulls. It's important to use the articulated skeletons for the articulated thoracic cage, again showing you the classification of ribs and how they attach to both the sternum and the vertebrae. And of course, use the vertebral column of these articulated skeletons to help you see the superior and the inferior and articular facets of the vertebrae. As you're sitting in lab, you can think through some of these points. We call them points to ponder. And this is going to be a good way to assess your knowledge of the skeleton as a whole. You'll also see these questions written at the end of the axial portion of the lab manual, so feel free to try to write them out. You may see these questions in lecture, but none of them will be seen on a lab quiz or practical. Please reach out with any questions you have either before or during lab, and we'll be happy to help you out. Again, the more preparation you do before you reach class, the less stressed and the more prepared you're going to be.